and welcome to this GP training update. For those of you that haven't met me, my name is Dr. Muhibur Rahman. So I'm a portfolio GP based here in Birmingham. My clinical work includes being a partner and also working in locum in different practices. I work in community detox. I work in a secure unit for women with severe mental health illness. So most of them are under section, and they have a psychiatric team that look after their mental health. Myself and my partner, we sort of offer the primary care and physical health, GP wellbeing. And then my main role is I'm the medical director of eMedica. I'm a consultant in medical education. I sort of teach courses up and down the country. I also advise people like the Medical Protection Society, and then I teach courses for Health Education England and RCGP Beds and Hearts on things like MRCGP preparation. So I've been teaching and training for about 15 years, and that's really where I've come to do this. Many of you might be in the GP Training Support Facebook group. There's 18,000 plus doctors in there, all in training or applying. So really, so many people have contacted me or asked queries in the group in the last week, 10 days especially since the exams got cancelled for both AKT, CSA, and SRA. And so I just thought it might be useful to try and take some of the things that have been published by the Royal College, by Health Education England, but also from talking to certain people and looking at what's been published and what people have said informally to try to answer a lot of the questions that a lot of you might have. Okay, so that's what we're going to cover. What we're not going to cover today is not a session. If you've got general questions about how to apply to get into GP training, we have other webinars, we have a lot of resources in the GP training support. That's not what today's for. I'm not going to take any questions on that. I'm going to take questions on the things that we said this webinar was about. So we're going to talk about the cancelled exams, the changes to current GP trainees, the impact for doctors that have already got a post and are starting GP training in August 2022, and then something really important, well-being during this current outbreak. So that's what we're going to cover. And then there'll be a live Q&A at the end. If you'd like to ask questions, please don't put them in the chat, which some of you have already been using to answer the question I've asked you. Please put your questions in the Q&A, and that's a separate tab. And what that means is that I'll get those in the order that they come, but also what it means is that I'm not going to take questions until the end, because many of you will have the same question. I found previously when we've run things like this, is that if I answer questions as I go along, I end up having to answer the same question 5-6 times by the end. So by answering them at the end, there might be 5 people that have asked the same question. I'll answer them in one go. Okay, it'll save everyone a bit of time. Okay, if you ask a question that is nothing to do with what this session is about, the question will be dismissed. It won't be answered, but you can feel free to contact me via Facebook or drop an email to our office, info@emedica.co.uk, and our team will be happy to help you with any queries to do with GP training. But today, this is what we're going to cover. Okay, so let's begin. So first I'm going to talk about are the cancelled exams. So it's not just GP that's been impacted, but pretty much all exams in the UK currently have been cancelled, all medical postgraduate exams. But specifically related to GP training, just want to talk about what the Royal College has said, and then what Health Education England have said about some of the recruitment exams. So if we start with the AKT, the MRCGP AKT, for those that plan to sit it in April, has been cancelled. And the Royal College has not given any indication as to when it's going to be held. Okay. What will happen though is, they have said that as soon as the current restrictions are lifted, and you've all seen, the lockdown started a couple of days ago, things are likely to get more restricted before they ease, because we're currently still on the uptick of this outbreak. Things are likely to get worse for all of us still doing clinical work. The pressure is likely to get more challenging before they get better, right? So AKT is not going to happen anytime soon, but I think it is likely that as soon as it's practical to put on new dates for AKT, that it will happen. So I think probably late summer. One of the things is, especially for doctors who are in ST3, if they can do a sitting before the October sitting, they want to do that for 2 reasons. One is it means that there's minimal delay to those doctors getting their CCT, because if they don't sit the exam till October, the results won't come till the end of November, and then that might mean they can't really get a CCT till December. And some of these doctors have got jobs lined up and like to start as soon as possible, as salaried GPs or partners, and so on. So I think maybe late summer there will be a sitting of the AKT, before October. The other thing is that if they wait until October, all the doctors that were planning to sit it in October, there won't be enough slots for them to hold that many on the same day. So, that would cause a problem in itself. So that's why I think personally that AKT is likely to happen late summer or early autumn before the October sitting. But it's certainly not going to happen in April. I think it'd be unlikely to happen in May or even June. I think it's likely to be after that. So what I would say for anyone that planned to sit AKT in April is I appreciate there's lots of pressures at work. And also, if like me, some of you might have young kids home now because schools are shut. And so you might have the pressures of that as well. So what I would recommend you do though is try to keep a little bit of gentle revision going. I appreciate you can't do the same intensity you would do if you knew the exam was just over a month away. Okay. But if you keep it going, even if you're doing only a few questions here and there, revising a few guidelines here and there, when they do announce a date, if you do plan to sit it before October, it means you're not suddenly trying to cram all of your revision at a time where clinical pressure is likely to get worse for us as well. So that's AKT. CSA, that I think is likely to be more challenging. And again, it's certainly not going to happen until all the restrictions are lifted. And that's because with AKT, it might be that if restrictions are lifted on large groups meeting, but not on travel, AKT could run. Why? Because there are Pearson VUE test centers all over the country. And once people are able to get back to work, you have a computer desk, there's a gap between you and the next person. The risk is much lower compared to CSA. You've got lots of simulators, lots of examiners, as well as lots of doctors. So two things with that is taking lots of people away from the front line, but also lots of people in one building at one time. So I think CSA is likely to be more delayed than AKT. It might be more practical to get AKT happening sooner rather than later. Okay, but again, CSA is cancelled until the Royal College announces there are no further dates. Certainly, I don't think that will happen till late summer, early autumn. Okay, MSRA, for doctors that have applied for round one re-advert and who didn't already pass or sit the exam and get through in earlier rounds, it's been postponed and they haven't given any dates again. All the Pearson VUE test centres are closed in the UK anyway at the moment because nobody, apart from key workers, are largely going to work, wherever possible, people working from home. So recruitment is just not going to happen in any way that needs face-to-face. So it's GP stage 3 cannot happen in its current form at all for this round, okay? Now, it may be Health Education England haven't made an announcement as to what they're going to do. They said they're looking at alternative methods to recruit. So it may be that they try to put on MSRA as soon as it's practicable. And then those doctors that get a direct offer, they might still be able to start, and they might just delay stage 3 or not go forward with that in this round, or look at another way to assess communication and consultation skills, which is one of the main things being assessed in stage 3. But there's no announcement on that. So until one comes through, we just have to wait and see. What may happen, if it's really not practical in any way, is that they may just postpone recruitment until round 2, or bring forward and try and do an interim round in between. But we'll just have to wait until the announcement's made. So that's the cancelled exams. So then I want to talk about changes for those of you that are already in training at the moment in relation to rotations, study leave and clinical work, ARCP and CCT. And then we're going to look at those that are starting training, that have got an offer and are starting in August. So if we look at changes for current GP trainees, a lot of you would have already received an email from your deanery telling you, because a lot of people were due to rotate beginning of April, that in most areas, you're just not going to rotate. And one of the reasons for that is when you rotate to a new place, often there's 2 or 3 days of induction. And until you've had that, you're probably not going to be safe to be contributing to the clinical workload. And right now, the people that would be doing that induction, the senior clinicians, they're needed on the front line. And that rather than have lots of people who aren't familiar with the working environment, working at a time of crisis, with this pandemic, that the thoughts coming from sort of Health Education England is that it's probably safer to keep you in your current rotations. Okay, so Health Education England hasn't published a national guidance, but there was a webinar yesterday with Yorkshire Deanery, Health Education Yorkshire, and they were saying that currently they are still planning towards rotations in August still happening. So if you we're due to rotate in April, but that doesn't happen, you are likely to still rotate the next set of rotations, because they hope that, that's another few months down the line, that hopefully things will be on the downward slope of the outbreak stage. Okay, but a lot of you might find that you're not rotating. Now, something else that's happening in some areas, and there's a lot of variation from different people that have contacted me, is that in some areas all study leave has been cancelled, but also for those in GP training, traditionally your contract is 7 sessions clinical and 3 sessions educational. So you have your VTS half-day teaching, you have your tutorials, that makes up 1 session, and 1 session of self-directed learning. So in some places, the tutorials are still happening, you're still getting self-directed learning. The VTS teaching isn't happening in person. In some places, they're looking at ways to maybe do some remote teaching, or what else you can do, or in some cases, they've asked you to do clinical work for that. Other places are expecting people just to do 10 sessions of clinical work, i.e. not having any of that training. You will still have supervision and debriefs at the end of your clinic. There's still admin time, but admin time is still part of clinical work, isn't it? That's not study time, okay? And so that there's a lot of variation. And what I'm hoping, because I know that the Associate in Training Committee and also some of the junior doctors from the BMA are sort of working towards contacting Health Education England to see what's happening, and the fact that there's variation. And I'm hoping there'll be a nationally published guidance on that, because I think it'd be really, I appreciate that we all need to think about the clinical pressures, but ultimately you're in training and there's a service element, but you still need your training time. It's really important. And so I'm hoping that, there will still be some training time, and it might happen in slightly different ways. Now, one of the things that I'm going to start from next Thursday evening, because some doctors have said that all their teaching's cancelled, is that I'm conscious people are still going to need to sit their exams, and also some people coming to the end of their training still need to start preparing for life after CCT. So I'm going to, until the lockdown is over and until things come back to a normality, I'm committing to do a regular free teaching session open to anyone in training. And it'd be like a national virtual VTS, basically. It probably be mostly Thursday evenings. I might not be able to do every Thursday evening, but I hope to do so at least every week or every other week. That's because I'm already have some teaching commitments on some Thursdays where I'm teaching some webinars for AKT. And then I also still have my clinical work. And as you can appreciate, things are busier now than previously. Okay, so in terms of ARCP, what's going to happen is that ARCP is likely to be postponed in most areas for the time being. And if anybody is sort of, when I say postponed, as in, you're not going to have to go physically there, they're still going to need to look at competency progression. And so that's going to happen remotely. If someone is short a few of their workplace-based assessments because it's difficult to get it done in the current climate, they're going to be conscious of that. And one of the things that has been committed to is that nobody's going to be released from training because they've got things missing because of the current crisis, that they will wait until after things calm down, and if people need to appeal or if people are short things, hopefully give you a chance for remediation. Okay, that brings me on to CCT. There's quite a few doctors who are in ST3 who are due to CCT in August, and they hadn't sat their CSA yet, but they planned to sit it. They'd even booked it for March. People had, done CSA, just waiting for AKT, and booked that for April. What's going to happen to them? So the Royal College has published on their website, and I will put links into the chat to, there's a frequently asked questions document that the Royal College has produced about AKT, CSA, workplace-based assessment, and CCT. So what they've said is that they envisage doctors working under less supervision than they have been doing currently, if everything else is up to date, but they may be missing some of their exams, but they will have to do those exams afterwards. i.e. you're not going to get your CCT, you're not going to be exempted from AKT or CSA. You will have to do those exams. You're just going to have to do them later when the exams can resume. Okay, that they're not going to waive the exams for anyone. Okay, that's what the Royal College's website says. Okay. Right, so that brings me on to doctors starting training and what we know. So if you're due to start training in August, the deaneries have started sending out those that need sponsorship, the forms to fill in to get your certificate of sponsorship. They've already contacted people to get references. So the plan is still for, if you're due to start first week of August, you're going to start first week of August. Okay. Couple of things in relation to that. Some of you had booked an ALS, but your ALS has been cancelled. So because it's unlikely any ALS is going to run until the restrictions are lifted, it might be that there are no ALS courses going to happen now until late summer, and you might not be able to get a slot. If that happens, what I would recommend you do is at least do an online BLS with CPR, and you can get that free on e-learning for healthcare. And at least it shows that, look, I've got the basics of CPR, of using a defibrillator, and I've booked my course. It was cancelled. It's out of my control, but I'm going to do it as soon as I can. And they're going to take that into account. All right. We want you to start training. Nobody wants people not to start. So they're likely to show some leniency in that, as long as you've got a place booked already, and the fact that it was cancelled is outside your hands. Okay, so that's for doctors starting training. So you need to make sure your references are done, get your other paperwork sorted, so that you can still start on time. Okay, that brings me on to I just want to touch on a couple of things about well-being, and that's because it can be really stressful. And I'm sure that I'm not the only one that is having to deal with the news constantly changing, seeing colleagues who are unwell, seeing maybe family members who are in self-isolation because they're not testing, but they've got some of the symptoms. And so it can be very scary. On top of that, we're all working more hours, and sometimes not getting, as we already discussed, as much training time or as much study time, where it's not the same pressure. Obviously, you're still, when you're learning, it's still a form of work, isn't it? It's not like you're relaxing when you're going to a teaching session, but it's not the same intensity as when you're doing clinical work, seeing patients. And right now, I'm sure there's a lot more throughput in terms of how many patients you're seeing and how intense the shifts are. A lot of hospitals have moved to doing 12 hours on, 12 hours off. That can be quite stressful. So it's really important that no matter how busy it gets, make sure you take time for a break. Ask someone to hold your pager if you're in hospital. If you're in GP, just go and have a break, have a cup of tea, coffee, stay hydrated throughout the day. And if you can, every day, just do a little bit of exercise when you can. Maybe when you get home, before you sort of, go down to sleep. Even if it's something, and there's a lot of free resources out there now, where you can do like high intensity workouts, follow what other people are doing, but try to do something, okay? If you can, maintaining social distancing, of course, but getting some fresh air, all of these things will help. And that if you are feeling worried, if you've got symptoms, it's important that you self-isolate for your own well-being and everyone else's. But if you are finding that the stress of it's getting too much, that please do ask for support. Please contact your program director, contact your supervisor, post in the GP training support group. We're a supportive bunch. We're here to support you. You can contact me via Facebook or drop me an email if you need help. It's really important that we all look after ourselves so that we can look after other people. And that, if we don't look after ourselves and we get burnt out and stressed out and become really unwell, ultimately we're going to suffer, but also it means that we can't help those around us. So that's something really, really important. I just wanted to touch on. Okay, so what I'm going to do for the rest of the session, as I said, I wanted to keep it to sort of about half an hour, 40 minutes maximum. So it's already been 20 minutes of me talking. Is really open it up now to questions. So I'm just going to look through the questions from the top, and then I'm going to have a quick look. Just give me a second, because there might be some questions that have been asked more than once. I'm going to try to answer those questions first, and I'm just going to go through them sort of one at a time. So actually, I've got two screens here. I'm just going to look at the questions. So if it looks like I'm looking away, it's because I'm just looking at the questions. Okay. So there's some questions here that are not to do with what we're covering today. As I mentioned earlier, if you've got questions that are nothing to do with what we're covering today, general queries about GP training or about applying or about less than full-time, feel free to email or message me those, but we're not covering that today because that's not what the purpose of this session was. Okay. So someone's asked, I'm due to finish in August and CSA has been cancelled. So what's going to happen? So yeah, so as I mentioned, I think they've said that you're going to have to do it. So it's not going to be that they're just going to let people get a CCT without having done CSA or AKT or workplace-based assessment. You're still going to have to get the same competencies that everyone to meet the regulations. As to when you'll be able to do it, as soon as they reopen it, I think it's personally, I think it's very unlikely to happen anytime in the next 2 to 3 months. But I think beyond that, so maybe late summer. So we're end of March now. I think April, May, June is unlikely, but maybe July, August. It might be possible. But otherwise, certainly, I think they're going to have to put on a sitting, if it's safe to do so, before the planned next sitting, which wasn't going to be until October anyway. So I think, as soon as practical, you will have to do it, and hopefully you do it, get through, and then get your CCT. Okay, so someone asked an excellent question, that what about someone who's due to start in August, but they aren't in the UK at the moment? When should they make their travel plans? I wouldn't make any travel plans now. To be honest, most places, they're not accepting bookings for flights into the UK at the moment anyway, because they know that there is likely to happen a situation like has happened in many countries where, apart from repatriation of citizens, they might not allow any flights in. Okay, but certainly I wouldn't book anything now. August, a long time away. Things, as you've probably been seeing in the news, are changing day by day. So it may well be that restrictions are lifted by August, and then as soon as they are, book then. It may be that this thing goes on for a lot longer than any of us want it to. That it may be several months, not just 3 or 4 months. In which case we'll have to deal with that when it happens. But I wouldn't make any travel plans until the current lockdown and the restrictions are lifted. And I would wait until as close to the time as you're going to plan to travel before booking. Don't book too far in advance. Will you have to self-isolate when you arrive? Again, that's difficult to say. They're hoping to roll out more widespread testing from next week, they've said. It may be by that time that testing is more widely available, and in which case people could be tested, and if someone's positive, they might need to be in quarantine for 14 days, but otherwise they should be able to travel as normal. Okay, so someone's asked, what if you're due to start in training in August and you're asked to do a hospital rotation instead of a GP rotation? Will that additional hospital experience count towards your GP training? Yes. So because they've asked you to do it, it may well be that they then get you to do additional GP later on in ST2, for example. But anyway, currently, as the regulations are, most people are doing somewhere between 16 and 18 months in GP and the rest in hospital. Now, not everyone does 18 months in GP anyway, because of 4-month rotations. In some places, some people only do 16 months. So they may well be able to add it on at the other end. And as long as you meet your competencies, it won't make a difference. Okay. Someone's asked, do we have to cover our missed rotations later on? No. So there are no set hospital rotations that you have to do in GP training anyway. Everyone does different things. Okay. So someone's asked, is the ARCP likely to be cancelled or postponed? And do you think we will still CCT during COVID? So if you've met all your requirements, i.e. you've passed AKT, CSA, workplace-based assessment, done all of the other things, then ARCP will still happen, but remotely, you will still CCT on time. Okay. However, if you're missing things, then again, it's going to happen remotely. They are going to postpone face-to-face meetings for anyone that needs that till after the travel restrictions are lifted. But what would happen then is that, essentially anyone that maybe is missing one thing, but they were due to finish in August, you're going to be given an extension. Okay, so that, you can sit that exam that you're missing or do the bit that you're missing later. Okay. So someone's asked, what if training is finished and your exams haven't happened yet? So yeah, you're going to get an extension. Okay. Similarly, doctors that need an extension of their visa, their tier 2, the same thing that already happens when those doctors get an extension would happen. You would get an extension of your visa too. Okay. So someone's asked, I've accepted a job and applied for deferment for August training. Do you think that will be affected? It might be, and that's because unless your deferral was for statutory reasons are things like maternity, then deferment is deanery based, i.e. each deanery sets their own rules. And in some cases, if they need doctors, they may not offer deferrals, or they may say that we can't offer a deferral for this long. So you'll have to wait and see what your employer says. Okay. Okay, so someone said that locally to them, all training's been suspended and everyone is doing clinical, and they're still expected to do learning logs. Okay, but without getting protected. So this is an example of something that's awful. That shouldn't be happening. And what I would recommend you do is contact your RCGP Associate in Training Committee, contact the BMA GP Trainees Committee. These are your representatives. Okay, and you should raise it yourself with your program directors and your supervisor, but this is where the power of many voices is likely to be more effective at getting change than one voice. Okay, I think it's really short-sighted. Yes, I appreciate the clinical pressures. Okay, I'm still working in practice, and understand that there are clinical pressures, but ultimately you are in training because you still need training. You still need to be trained. Part of that is education. Okay, and yes, look, these are exceptional circumstances. So I understand, in short term, sometimes some weeks things might need to happen, but you should ultimately still be conscious that ultimately we need to support you to complete your training. Part of that is education. Okay, part of that is training time to be able to do these things. Okay, you should still be getting debriefs and have a chance to talk to your supervisor about learning points and things like that. Okay, so if that's not happening, absolutely raise that please with your program director, and then contact your representatives, both at the BMA and the Royal College, and see what can be done as a group. I think what they could be able to do is, if they can collate where, because it's happening in some areas but not others, that would be really powerful to say, look, it's very inequitable and unfair that trainees here are still getting supported to have training time and education time, yet trainees here are not. That's going to increase those trainees' risk of sort of being overloaded and struggling, and that's not fair. And that hopefully will lead to change. But I absolutely support that. Training still needs to have an element. I appreciate it might be reduced, and I think to expect to still get 30% training time while this is going on might be difficult. Okay, but I think at the very least you need some education time. And as I said, one of the things we will be doing outside of, regardless of what does happen locally, I've committed to run free education sessions open to anyone in training, in a webinar format, covering important topics, both for in training and after you finish training. So we'll cover some careers topics. We'll cover things like telephone consultation. We'll cover recent clinical guideline changes that might impact you, hopefully help you for exams, but also help you day-to-day practice, because that's the things I'm seeing in practice myself. Okay. So someone said, I'm currently on maternity leave and due to go back in June. Would you recommend going back earlier given this current crisis? So that is a really personal decision that you need to make. You need to think about, ultimately you've got protected time, so that if you want to have that time to, be with your baby, to spend that time to also have the rest that you need, that's there for you. If you feel, look, I feel rested enough, I've got people who can look after my baby and I feel like I want to go back early, contact your junior. I'm sure they'll be happy to facilitate that. But please don't feel compelled that you need to go back early. Okay. So someone's asked, will we be redeployed back to a hospital ward? So that again, there's sort of no clear answer on that. In most areas where people were in hospital due to rotate into GP, they've been kept in hospital in some places and not rotating into GP. Okay, but where people were in GP and due to continue in GP, I don't know of many places where they've been asked to rotate back into hospital. Most of them are staying in GP. The exception to that is there are some doctors in GP training that maybe had expertise that would be really helpful now. So, I know some people who previously were registrars in ITU or intensive care or, things like that, who feel, look, I'd like to use my existing skills to do what I can in hospital. And they've requested it. If you like, they've volunteered for it, and that would be facilitated. But I haven't heard of many people who are in GP who weren't due to rotate into hospital being asked, or who are in ST3 GP, for example, being asked to go back into hospital. GP is also short of doctors because of doctors becoming unwell, going into self-isolation, being contacts of people, or having family members who are unwell. I know of several qualified GPs who are right now, friends, colleagues who are in self-isolation or have got family members who are being shielded because of severe immune compromise, and so they need to be home to look after them. So someone's asked, ST3s that are due to complete in August, will they extend their training beyond 3 years to do CSA? Yes. If you can't sit the CSA because the CSA hasn't happened, not your fault at all, but you've done everything else, they're going to extend your training and you will continue to be paid. And they've said that, will you continue to be paid as a trainee? Yes, but that will be the same if you were given an extension for any other reason, okay? You won't be paid as a qualified GP until you get your CCT and have qualified, okay? So someone else asked about maternity. They're worried about when they go back, going straight back into hospital after a long break. One of the things that you can do is recommend make contact early. You can do some keeping in touch days so that you can go and shadow and sort of see how things are doing, so that you familiarize yourself and build up. And the other thing that you can do is, if you feel that it might be a bit too intense to go back full tilt, is maybe consider going less than full time, so that you're getting a bit more break and can build up to it. Okay, so for someone's asked, and I've had some queries about this in the group as well, that they'd applied for round 1 re-advert and their status has changed from applied to long-listed. So everyone that meets the eligibility criteria is long-listed, but because the SRA is cancelled until further notice, it doesn't mean anything, okay? What I recommend you do if you're in that situation and you have to sit the exam is just keep your revision going, because they may announce either a date for the exam, when it's safe to do so at Pearson VUE, or they might find another way to deliver that exam. Because, for example, I do know that trainees applying for the Widening Access to Specialty Training, the WAST, they were able to do their SJT online in their house, as long as they had a laptop or a computer with a camera. So what it does, it takes pictures every so often to make sure that you're not looking at a book or looking something up. It takes it randomly so that they know someone's not cheating. Now, the thing is, to set things like that up take time, and at the moment all the Pearson VUE centres are shut, so there aren't even people to set it up. So even if they did do something like that, and WAST has very few people applying, whereas there's a lot more people applying for GP training, so it might be logistically not possible, but I know that technology exists, okay? So it might be that they can do that at some point, but if not, at some point you're gonna have to sit the exam, right? Okay, and so just keep your revision going. All it means is that at some point you're going to be invited to sit the exam. It's just not going to happen now, because exams were due this week. That's definitely not happening, right? All the Pearson VUE shut. Just keep your revision going, so that, if anything, look at this as a blessing in disguise, that you've now got a bit more time to be more prepared to get a better score. And if you had already sat and got through SRA in the last round, so you're going to have to resit stage 3, again, you can practice that at home. Just keep preparing, okay? So someone's asked, what if we're required to self-isolate and that takes us over the number of days that you can be off before you need an extension? Would you lose your place to start in August? Okay. There is no clear guidance on that. I know historically, if people have not met the minimum required time, like you need 24 months by start date, and if you're off sick, you've got to more than a certain number of days, you've got to make up those days, because otherwise you haven't completed that time. They weren't allowed to start. However, in this current situation, there's going to be so many more doctors that maybe need to self-isolate because they've been in contact with someone who then tests positive or things like that. I would hope they would make some allowances, but they haven't published anything on that. So I can't say that for certainty. I'm not the one that makes the rules. So it may be that they would allow you to have a delayed start. I would hope that would happen, okay, rather than that, they would have you lose your space. Okay, so that's the same question someone's asked earlier. I've already answered that. So someone's asked, for those starting in August, will the first rotation be hospital-based? So you don't get to choose which rotations you start with. They will allocate you the rotations. Whether they will be hospital-based or GP-based, they will tell you when you get your rotations, okay? Wait till you get them and you'll see, all right? But you don't get to choose which rotation you started, okay? asked about, will this then have an impact on later recruitment? Will round one still be November 2020? Yes, round one will still be November 2020. So someone asked, assuming the restrictions are lifted, how soon after that do you think AKT could be held realistically? I think within a month after they're all lifted. Why? Because the exam questions for the April exam have already been set. Okay, the exam was ready to go. Typically, the exams questions are set about 6 weeks or so before, get sort of finalized, maybe even a bit earlier. So the exam's ready to go. So as soon as the restrictions are lifted, obviously they've got to then give people some notice, because then they've got to be able to get back in the mindset of doing their final prep. But this is one of the reasons why I've recommended to people that if you plan to, like a lot of people have said, look, I've got a lot of stress now, work's busy, I've got my kids at home, I'm a bit more tired now. With everything else going on, I'm finding it difficult. I've got relatives I'm worried about. I can't study now anyway. I'm just going to sit in October. Okay, then that's fine. Okay, keep your revision ticking over at a slow burn. But if you are planning to sit it as soon as it's possible, this is why I recommend you keep your revision going. This is why we still ran our AKT course last weekend, and we're running one this weekend, but via live stream, of course, to make it safe. We're not going to have anyone that we're going to be in London and in Manchester. We have to convert it to live stream, so that, because a lot of doctors said that I don't want to wait till October. I still want to sit it as soon as it's available. And no one knows when that date is, but realistically, it's possible. Let's say if things get lifted in, say, 3 months, it could happen, late July or August, for example. It's possible that they might put in a sitting as early as that. Okay, but until an announcement is made, no one can say that for certain. Yeah, so I can see there's a lot of questions on the same trend, so I'm just going to answer them all at once. If you get to the end of your ST3 and you haven't passed either AKT or CSA or completed workplace-based assessment, because of this current crisis, you will be given an extension and continue to be employed in the same place in most cases. In some cases, when people have an extension, they do get deployed back to hospital. That has happened in the past, okay? So that could happen again. And you will continue to be paid as an ST3 until you finish and meet all the requirements to get your CCT, okay? Someone said, because they've had their rotations changed, they won't have the minimum 18 months of GP training. So actually, the current regulations don't mandate a minimum 18 months in GP training. So that's okay. As long as you pass everything, it won't impact your completing training. Okay, the regulations will change from 2022. That actually it'll be only 1 year in hospital and then 2 years will be in GP. But currently, while it's recommended you have 18 months, there's lots of doctors that only have 16 or so months because of 4-month rotations. They have a 12-month in ST3 and only 1 4-month rotation at some other point. So lots of people, there isn't actually a minimum 18 months in the guideline. Okay. So someone asked, if I get an extension to training, does it mean we will have to move GP practices? So extensions work in different ways. In some cases, you'll stay at the same place. In some cases, they'll send you back to hospital. In some cases, if, for example, your practice has got someone else due to start and they don't have another trainer or capacity to have 2 registrars, they might move you to a practice where there is a vacancy. In most cases, they try to keep people in the same place for continuity, for extensions. So someone asked, what if I'm pregnant during this outbreak? What should I do in terms of work? Contact occupational health. They should risk assess you. They might be able to offer you, for example, if you're in practice, doing telephone triage and things where you're not coming into face-to-face contact. But this is the same as any illness. If you're worried, if you've got immune compromise and you think that you might not be safe to be at work, please contact your occupational health department and they will assess you and advise you further. Okay. So someone's asked again, GP training in August is going to go ahead. Okay, round 1 re-advert is cancelled for now. It's likely to happen at some point, but there is no date published as to when. But all face-to-face, so like GP stage 3 cannot happen in the current situation. Okay. So someone asked, can I resign from my current non-training job as I'm due to start training? Yes, look at the notice period. In most cases, it's 1 month to 3 months. So make sure you give adequate notice, and then you can resign whenever you're ready. Someone asked, will training be deferred if situation doesn't improve? So if you mean if things still aren't lifted and you can't physically come to start in August, yes, they're not going to withdraw your offer. That's out of your control. Okay. Someone asked, do you think the RCGP will give enough notice before the AKT? impossible to say. This has never happened before. In the 15 years I've been teaching and the 39 AKT exams that I've helped people prepare for, they've never cancelled a sitting. The only thing they have done is there was 1 year where usually they hold it the last Wednesday of April, the last Wednesday of October, the last Wednesday of January. And there was once where that fell very close to Easter, so they moved it to May. But it's never been, so it's been postponed by a couple of weeks, if you like. It's never been cancelled before. But then there's never been a situation like this in our lifetime. You know, everyone's trying to adapt to the situation. So RCGP is meeting with Health Education England and with the body that oversees postgraduate medical training overall and the GMC to, you know, look at what's going to happen. But, you know, they're not going to suddenly say it's lifted, the exam's next week. That no one's going to have time to prepare. I'm sure they're going to give some notice. How much? It's impossible for anyone to say. This has never happened before. Okay. But this is one of the reasons why I recommend I appreciate you can't do full strength revision, if you like, okay, like you would be doing, like, you know, if you were sitting in April last month, you would be doing work every single evening, probably several hours on the weekends. You know, you can't keep that pace up for 3-4 months, but try to just do a little bit here and there, even if it's half an hour one day, you know, 20 minutes the next day, 15 minutes. Even if you do a little bit, just try and do a little bit, okay. It will help. So someone's asked out of hours requirements. I've been told we still need to be doing this. Most of out of hours is not happening face to face now anyway. In most cases, it's, you know, almost 100% telephone triage, and where people need to be brought in, they're screened as unlikely to be for this before they're brought in. If they think that they're possible, you know, COVID based on symptoms, they're either going to be told to self-isolate if they're low risk, or if they're bad enough that they need to be in hospital, they'd be going directly to hospital anyway. So yes, you may still need to do that, but the risk shouldn't be that different to what you'd be doing in day-to-day general practice, in that in most cases in general practice, we're also mostly doing telephone triage. And then when you see patients that might be at risk, so I had a patient last week that, you know, fit the category to be risk, so I had to put on PPE before I would see them, and then advice about isolating and things like that, you know, for the patient and other people. But for other patients, you know, we can screen, and in most cases it's going to be telephone triage. Okay. So just to give you all a warning, there's still a few questions left, so I'm going to go on for another 5 minutes. After that, I really need to get away because I've got other things I need to get on with, but also I know a lot of you need to get away, and I'd said it'd be 40 minutes no more. It's already been 50. So just I'm going to get through the last few of these. Okay. So someone asked, just to clarify, if you require an ST3 extension, can you be redeployed to a hospital placement? Yes, that has happened in the past. If someone needed an extension, you know, in some cases there wasn't capacity for them to have that extension in GP, then some extensions do happen in hospital. It's possible. Okay, great. So actually that's okay. So someone has asked, I've paid for the April AKT, and the same would apply if it paid for the CSA in March, okay, because a lot of people had booked and were about to sit it and then got cancelled the day before. Will they automatically carry over? Yes, they're going to retain your fee. If you need the money back, you can ask for it back. But if not, they're going to keep it for you. And as soon as the exams reopen, they will take that fee over. But also anyone who they're holding your fee, you will get first priority over people booking for, you know, new bookings for October, for example. Or if they do have a sitting before October, say late summer, early autumn, they'll carry that over and you'll get first dibs on those. So, you know, if you need the money now, which, you know, some of us might need it, you can ask for it back, and they hope to get that back to you at some point in April. There may be some delays, but if you feel, look, I'd already paid that anyway and I don't need it now, it was for my exam, it was already spent, I'd accounted for that to be gone, they're just going to hold it for you until the next sitting. That's the same for AKT and for CSA. Okay, great. So that's all of the questions that I can see that were in the Q&A. I can't see any others in the Q&A. So thank you very much, everyone, for joining. I hope that that's been helpful. Okay. In terms of some of the links that I talked to you about, like where you can get BLS training, tomorrow, I haven't got time now, so I've got a few things I've got to get done now. But tomorrow, I will put together an email with links to like where can you get BLS training, if you need to get safeguarding training, for example, because you're coming close to CCT and you can't do it face to face, where can you get access to some of these things via e-learning? I'll send you some links to that tomorrow, okay? Because when you registered, you would have put your email in. So we'll send some links out to that. And then, as I said, from next Thursday, for those of you that are in training, this is for anyone in training already in ST1, ST2, ST3. From next Thursday will be my first free national VTS, if you like, free teaching. So we're going to cover, topics, clinical topics, and then some topics to do with careers. It won't be long, it'll be like 45 minutes each time, but I'm committing to do that just so that if your teaching is cancelled locally, you can still just keep some things going on the side, okay? And so anyone's free to join. If you're not already in the GP Training Support Facebook group, make sure you're a member, because I will post links on there, but also post some links on our website. I'll just post in the link the GP Training group. Okay, so I'll just post that here for everyone to see. Okay, and then on our website, I'll also post links to where that free teaching will be. We've got a section for COVID updates. I'll post it onto there. Okay, and this is our website here. So I look forward to seeing some of you, those are in training, next Thursday evening at 8 p.m. for that free teaching. If there's specific topics you'd like me to cover, I might not be able to cover that next week, but I'm planning to do these, weekly or bi-weekly for the next couple of months until, things get back to some sense of normality, just so you can keep your training and your education going. It will be free for anyone to register, okay? So tell your friends if you think that they might find it helpful. Drop me a message or an email as to what topics you'd like me to cover, and I'll try to build it in over the next 3-4 weeks. Okay, thank you very much, everyone. Have a great evening. Remember, if you need anything, you can always contact me via the website or through the Facebook group, or send me a message. I'll try to get back to you. Please stay safe, look after yourself, and look after others. Okay, thank you so much. Have a great evening, and thank you for all your hard work on the front lines. Okay, I'll see you all soon. Thank you.